What eyelid surgery do I need? I've got horrible eyes and I'm only 20. I don't know if simple eyelid surgery will help me. Can anyone explain everything I need to get nice, normal eyes? Do I need implants as well for eyelid support? I'll go anywhere in the US for the surgery I need. I just need to know what type of surgery is required.
Thank you for your question. You submitted a single photo, a close-up of your eyes, and you're asking what's wrong with your eyes. You feel like your eyes are horrible and you are willing to travel anywhere in the United States to have something done, and you're 20 years old. Well, certainly I can share with you a little bit of understanding of what I see in this photo, and this is in the absence of a physical examination. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I can certainly just give you an understanding of the anatomy that is relevant to your situation. So let's begin with definitions. Your upper eyelids may look a little bit low, which would be referred to as ptosis, or drooping of the upper eyelids. But I think what's relatively more significant is the position of the outer corners of the eye relative to the inner corners of the eye. And this is referred to as lateral canthal dystopia, or a downward displacement of the outer corners of the eye. Now, in our field, and in general in the field of plastic and cosmetic surgery, we refer to things as certain norms. But of course, there is going to be ethnic and genetic variations. So what is, quote, normal is that the outer corner of the eye is 1 to 2 millimeters higher than the inner corner of the eye. And in your situation, the outer corner is lower. Now, in my practice, I see similar situations, but more commonly as issues related to aging, where the outer corner of the eye sags and descends, or after complications of cosmetic eyelid surgery, which is a single part of multiple other issues, such as lower eyelid retraction and ectropion. What I suspect your situation is more of a familial situation, where people in your family probably do share this same genetic appearance. So I think that it is important to understand that perspective. Essentially, any type of surgery would be to change what is your natural anatomy. Since this isn't the result of aging or a complication of eyelid surgery, you're talking about doing something that is changing the natural anatomy to try to create a different appearance. Now, I would propose to you that you delay any type of surgery since you are 20 years old, and there are still some facial volume changes that will continue to occur as you get older. And I think it would be in your best interest to allow for those things to happen before you make this type of decision, which will involve relatively advanced surgery, and you have to essentially accept what would happen subsequent to that, because it's difficult to go back. So it's a very, very important decision. So at this point, you may want to get some opinions and get some guidance and understanding. But from my perspective, if someone like yourself would come to my office at your age, I would most likely delay or defer having any surgery until the time would be at a point where your face was more, let's say, more mature, and you can actually also have a better sense of overall of what the outcomes will be. It's difficult to really make a significantly dramatic change when you're dealing with the genetics that's in the family, that is basically the whole structure. And the point is that it's not just the way the eyes are shaped, it's also the bone structure, the tendons, the support, the amount of tissue. So whatever would be done, it would be relatively involved. So you have to understand that and make that decision when the time is right. But of course, it is very important for you to get educated and informed and then see whether or not this is as important to you several years from now as it is currently. I can tell you there are a lot of famous people who have this type of appearance who have very successful careers in terms of movies and other things that where you would maybe assume they wouldn't otherwise have had. So it's I think you have to also maybe consider embracing the look if it's something that is part of your familial appearance. It might change as you get much older, but for now I think it's okay to at least learn more and have physical examinations to get a better understanding. So I hope that was helpful. I wish you the best of luck, and thank you for your question.